Walgreens has released COVID data regarding who is testing positive and who is testing negative for COVID with respect to a patient's vaccine status. The conclusion, as reported by, well, some media outlets, vaccines could be harming our immune system, making us even more susceptible to COVID. Or maybe this data doesn't make any sense at all, and making any inference based on it is erroneous, and Walgreens' bar chart is just horrendously misleading. Let's look a bit closer at this, shall we? Determining the efficacy and safety of vaccines is a challenging and highly important task for medical researchers, but spoiler alert, this bar chart is the worst bar chart I've ever seen. Let's consider how we would want to run this experiment for real. This data almost looks like a contingency table. So a simple example of such a contingency table would be, say we have a cohort of university students and we wish to know whether or not the performance of the domestic students roughly matches the performance of international students. So two categories here. We can set up this contingency table with rows corresponding to domestic versus international and columns corresponding to, say, the letter grade they got in calculus class, right? Then we can do a standard goodness of fit test to determine if the row and column categories are independent or not. If they are independent, the null hypothesis here, then there's no detectable difference between the performance of domestic and international students based on the available given data. Otherwise, we reject the null and conclude that performances differ between these two groups of students. Most importantly, this test doesn't tell us how the students differ in their performance, but just that they do differ. And to determine how they differ, we would need a follow-up test. Now let's look at this Walgreens data. If we try to realize this as a contingency table, we run into some trouble. A proper contingency table would report the number of positive cases and the number of negative cases stratified by vaccine status. However, here they're charting the number of positive cases against the total number of people tested, which includes positive and negative cases. This amounts to having one row of our table and then the column sums of the entire table, which is not what you want to compare in a goodness of fit test. That makes me a little bit worried, right from the start. The next thing is to note that the data presented is incomplete. Mainly, we do not know the sample sizes. To do a proper analysis, we need two missing numbers. We need the total number of people tested and the COVID positivity rate. If we have those two numbers, we can fill in the entire table and run a goodness of fit test. So that's exactly what I did. We can make some educated guesses at what those two missing numbers are. The data claims to come from the last 7 days, so the total number of people tested, well, I ranged it from a sample size of 1,000 to 10,000 people in each age category, those being children 5 to 11 years, teens 12 to 17 years, adults 18 to 44 years, older adults 45 to 64 years, and the elderly 65 and older. I considered 3 different positivity rates, being 1%, 5%, and 10%, which seem reasonable COVID positivity rates based on CDC data. Given all of this, we can chart the p-values for our goodness of fit test as the sample size grows. If the positivity rate, the COVID positivity rate, is 1%, none of these age categories are significant at even the large sample size of 10,000 tests performed. If the positivity rate is 5%, then the proportions in the younger age categories are still not statistically significant, even with large sample sizes. For the 45 to 64 and 65 plus categories, we start to see some moderate statistical significance in this table, assuming that the sample size is greater than about 5,000 to 6,000 tests performed in the last week. If we assume a 10% positivity rate, then we would only need about a sample size of 3,000 to 5,000 to claim statistical significance between these proportions of positive and negative tests, conditioned, that is, on the vaccine status. What does this all mean? Well, simply put, sample size is critical to determining the significance of these charts. If the total number of tests or if the positivity rate are very low, then there's nothing statistically meaningful here at all. In contrast, if the sample size is big and or the positivity rate is really high, then this would imply more statistical significance. At this point, we have no idea if the bar chart is significant or not, given what's presented here. And if it were to be significant, then we'd need to follow with post hoc testing to determine where those differences lie. But we're not done yet. Even given the sample size and the positivity rate, there are still some other issues with this dataset. One, they aggregate all of the age categories together, where presumably each group has radically different sample sizes, behaviors, and whatnot. Maybe senior citizens go to Walgreens all the time to get tested midweek, while young adults are too busy working to, well, go get tested. Number two, the younger age categories didn't even fill up every vaccine category. Specifically, no children in this dataset have had 3 vaccines, which will further bias the aggregated totals if you try to include all these categories. 3. Vaccine status can be correlated with health status. Specifically, people with poor immune systems are presumably more likely to get more vaccines to protect themselves and are more likely to get sick because, well, they have poor immune systems. Those with 3 vaccines or more may have a problem maintaining their immunity. 4. The people who got tested at Walgreens may not and probably isn't a representative sample of the US population. Furthermore, these people are presumably exhibiting symptoms, otherwise they wouldn't be tested in the first place. So this is a very specific subpopulation of the grander US population. 5. There is no information on previous COVID infections in this dataset. People who are unvaccinated may have already contracted COVID, and those who have been vaccinated may have also had COVID either before or after their vaccine doses. And 6. Okay, this one confuses me a bit. The bar chart graph shows 2 views based on a 7-day moving average. If they mean aggregating the last 7 days of data, okay, I'm okay with that. But if they mean applying a moving average filter to the last 7 days of proportions, then this is super erroneous. It would be like saying, well, yesterday, 3 out of 4 people tested positive, 75%. Today, 100 out of 400 people tested positive, 25%. So, on average, well, that's about 50% positivity every day. I hope and pray that is not what they're actually doing, but the documentation scares me. I assume it's not what they're doing, but still. In conclusion, are vaccines irrevocably damaging our immune system? I have no idea, mainly because this Walgreens bar chart gives 0 useful information at best, and at worst it can actually be quite misleading. It's really astonishing just how useless this bar chart is. I need another cup of tea. So it looks like Walgreens did actually put up a white paper with the date of May 11th May 11th, 2022, to be specific, for the most recent update. Now, their research findings are a little bit more reasonable than just staring at that peculiar bar chart. Though I do note that they say something like, on the surface, these results are counterintuitive and may lead to a misinterpretation. Yeah, that's definitely a problem if you post them and don't really explain what's going on here. So in this work, they do have some bar charts that are not completely erroneous. In figure 1, they have positivity by previous infection and reported close contact. Now in this case, it looks like they're properly splitting up the data into the 2 groups, vaccinated, unvaccinated, or specifically vaccinated but more than 5 months ago and unvaccinated, and then categorizing into these people into 4 different categories, being previous infection with no contact reported, or with contact reported, or no previous infection, or no previous infection and still being in contact with someone. And they do have sample sizes here which range from anywhere from about just over 2,000 to, in one case, over 50,000. Now, I don't see specifically over what time span this was aggregated. I mean, there are, according to this, I guess about 6,000 to 7,000 Walgreens I don't know how many people go and get tested at Walgreens every week or every day. Yeah, the other thing is that they do report their significance at a p-value of less than 0.5%. Of course, it doesn't seem clear if they're doing any proper multiple testing correction, and there's a lot of hypothesis tests going on here with all these different splitting the data up into different categories based on contact and vaccine status, different symptoms. Most notably, that bar chart that I was ranting about earlier does not seem to appear in their white paper, so yeah, I still don't like that bar chart. Fix it.